Good evening, everyone, and welcome to our Facebook Live brought to you by veterinary teleneurology. Another beautiful evening here in the south of England. It looked like my colleague in the US have made a good start of the day as well. I'm delighted tonight to present to you Lisa Bartner from Colorado State University, who has very kindly accepted to talk to us about an area of research and interest, which is the use of cannabidiol or CBD in neurological disease, and more specifically in epilepsy. If you're not familiar with the format of this Facebook Live, Simon and I, every week, and it's the fifth one, we invite a guest with a specific area of interest or someone that has done extensive research in a subject relating to neurology. And we submit to our guest question prior to the meeting. Simon will put this question to our guest. And then at the end of the 20-25 minutes interview, I will select a number of questions that you can now submit in the comment box to put to our guest. And then hopefully we'll be a little bit more clever at the end on the subject that our guest has offered to talk to us. And particularly tonight, I'm very excited to hear about a subject that I know very little, and I'm sure a lot of you have been in the same situation, being in consult with a pet owner, asking you, and what about CBD? Can we use it? Is it worth trying? And until very recently, there was very little in the literature. I think a lot of neurologists on both sides of the pond know very little, and except Lisa is one of them, but actually has done quite a lot of research in the subject. So let me tell you briefly about Lisa. She is graduated from Michigan State University. She done the residency in Colorado State University, where she's actually currently have a faculty position, and she's also an ACVM neurology diplomate. And as I say, area of expertise is CBD. And I'm really delighted tonight that she will enlighten us about this subject. And hopefully next time we're stuck with a pet owner asking us about CBD, we'll know, what to say, and we won't waffle like I've done so many times. I'm going to pass on to Simon to ask Lisa a few questions. And thank you again for joining us, Lisa, tonight.
Thank you.
Yeah, thank you very much. Thanks for that introduction, Laurent. I liked how you got out there now for the world, recorded live, a legal statement that you don't even know what cannabis, marijuana is. You've never heard about it before.
I think everyone know. I know what is a beer.
It's all, that's now
I
your
don't even
legal
know what you look like.
Okay. Well, it is, as Laurent then said, a very common topic of conversation with clients, and we know very little in this area, and so we are fortunate to have you here, Lisa. So thanks very much for coming on. And we're going to start with getting to a bit of the grassroots of the understanding and asking you to explain just what is cannabis, marijuana, hemp, what the differences, and can veterinarians currently prescribe them? Are they legally able to do this?
Yeah, so I think whenever we're looking to try new things with an old remedy, it's probably helpful to look back at the origins of that therapy and look at how people before us have used it. Perhaps before there's all these regulatory agencies that have come into the picture. And so if we look at the origin of cannabis, it's really been around for thousands and thousands of years, probably getting its grassroots, as you said, in Asia, where it was extensively used for textiles, for its fiber and seeds. It had recreational uses and also medicinal purposes. In the years, it wasn't until the 19th century that it kind of made its way over to Western medicine and has more of a role that we've sort of been accustomed to today, where it has medicinal purposes, pain relief, migraine, so on and so forth. And in the years since, cannabis-based extracts have really been taking a strong foothold in the treatment of almost everything from curbing anger to appetite to slowing dementia and Parkinson's disease, treating chronic diseases, pain, even opioid dependency. And of course, the focus of today's discussion would primarily be around epilepsy. And so this begs to answer the question that this Time magazine article has posed with this little presumably CBD gummy bear is, can CBD really do all of that? And there have been some recent changes in the governing agencies recently that have opened up avenues for us as researchers, at least, to begin tackling that question. And so if we kind of take a quick glance at the legal history of cannabis, since the 1970s, cannabis, the plant, and all of its derivatives have been controlled under the Controlled Substance Act, or CSA, within the drug class of marijuana, which is listed as a Schedule I drug. And then in 2018, at the end of 2018, there was the Agricultural Improvement Act that was passed, or otherwise it's known as the Farm Bill. And at least in the States, that's removed hemp and, again, its derivatives from that CSA control. And so by doing that, they are exemplifying and only referring to hemp and the products which contain less than 0.3% THC on a dry weight basis. And so these substances are no longer considered controlled under federal law, at least. And so as you can imagine, now that they've lightened up some of these restrictions, this has really taken an even stronger foothold in the media and across the country, at least for the United States. So if we go to the next slide, this is a map from Business Insider, just taken from January, showing the states where marijuana is either legalized, so the blue states, or legalized for medical marijuana, rather. And then the green states indicate that, which is legalized for both recreational and medical purposes. And you can see that, I mean, upwards of probably half, if not more than half of the United States is now joining these groups. And so as these products are becoming more available, veterinarians are seeing an increased interest in clients using these products for their own pets. These products are becoming more widespread and more widely available, and they're understandably asking, are these products legal? Are they safe, effective? Can they treat medical conditions in their pets? And so as vets, we really need to be able to provide guidance. And so I think a helpful place to begin with that is to understand the client's motivation and the owner's motivation with wanting to use CBD. I think a lot of them perceive it as a sort of natural therapy. It's potentially, they see it as an alternative to pharmaceutical or surgical interventions. Many of them have had positive experiences with it, whether themselves taking it or having a loved one or a close friend. And of course, again, this media coverage that's been amplified exponentially has really placed CBD as a common household term. Even in the early 2000s, I'm reminded of a young girl named Charlotte Figge, who was a resident of Colorado, and she had a very severe form of retractable epilepsy where she started having seizures at 3 months of age, very young age. And out of desperation, her parents visited doctors in Denver and ultimately were started on Cannabidiol. And her seizures improved immensely. She went from having upwards of 300 grand mal seizures a week to just having a handful a month. And so they've rightly named her strain Charlotte's Web strain in her honor, and portraying the effectiveness of this, at least in children. And so these and other similar stories have really been gaining a lot of ground in the media and in literature as well. I think it's a good time to pause and just note that although all these states and the laws that have removed restrictions have taken place, these are restrictions that are implemented for people, and they do not apply to their use in animals. So all of these restrictions being lightened are exclusively related to people. So if we go to the next slide, going on to the terminology portion of your question, I think cannabis, marijuana, THC, CBD, they're all kind of confusing terms, and a lot of them are used interchangeably. So to get some of that terminology under our belt, cannabis refers to the plant, the family of plant that houses these particular compounds. And so typically we're talking about the species Sativa, Indica, or ruderalis. And within that plant, there are over 400 different types of compounds, 80 to 100, which are called cannabinoids or phytocannabinoids, since they're from the plant. And these are where THC, which is delta 9 tetrahydrocannabinol, or CBD cannabidiol fall into categorization, but there's many others that haven't gotten quite as much publicity. But other parts of the plant have a lot of use. There's the fibers for textiles, there's seeds that are harvested as well. And then within those components, there's other biologically active compounds like flavonoids, terpenoids, omega-3 and 6 fatty acids. And so another product that we won't touch on much today, but I think would be worth bringing up is hemp seed oil, which is advertised a lot. And hemp seed oil comes from, as the name implies, from the seeds of the plant. And this oil is very rich in omega-3s and 6 fatty acids, so it has the presumed and proven benefits of those compounds, but it does not contain any cannabinoids. So hemp seed oil is completely exempt from any of these restrictions or laws because it doesn't contain any cannabinoids. So if we go to the next slide, the two main groups that marijuana and the plants are divided up into is hemp and marijuana. Hemp comes from plants that are mainly fiber producing. These again are the plants that contain less than 0.3% THC, which is a psychoactive substance. They're usually rich in CBD, which is the more medicinal substance. And this is what has been deschedulized under the CSA in the 2018 Farm Bill. In contrast, marijuana is higher resin producing type plants. They have much greater than 0.3% THC, the psychoactive component, usually upwards of 20 to 30%. And this still remains controlled under the Schedule 1 compartment of the CSA. So when we're talking about use in people and pets, we're only talking about hemp, and that's what's been deschedulized. So to answer the question of is it legal to prescribe these products, if we go to the next slide, the short answer is no, but of course there's caveats and segues, but really there's no FDA approved cannabis product for use in people. And the AVMA has a nice legal website, and this was taken from that website, that to date, again, all these medical marijuana laws only pertain to human patients and the products that are prescribed by human healthcare providers. They do not authorize veterinarians to administer, dispense, or prescribe these products, nor does it authorize them to recommend them. In the last few years, however, there is one FDA-approved product of CBD that's used in children, is approved in children over 2 years of age for treatment of a very rare, severe form of epilepsy. And under the AMDUCA Act in the States, this does allow veterinarians to use this drug extra label. It is a Schedule 5 controlled substance. And last I've heard or checked, it was cost prohibitive. So it's not being used much, but this would, outside of this medicine and this drug, there really aren't any FDA products that we could use in people. And really using unapproved drugs puts patients at risks. It also has legal risks for veterinarians who administer or prescribe these because they haven't been evaluated for efficacy or safety by the FDA. The risks could be heightened because clients may opt to use CBD or these products over approved treatments that are available, and so there's risks to the patient as well. So really what we need is good evidence-based medicine with well-designed studies to show the safety and efficacy of CBD so that the FDA approval process can begin and we can get a safe and legal and regulated product out in the market that can be available to us and our clients. And hopefully with the passage of the 2018 Farm Bill, this has allowed some of these studies to begin, but we still have a long way to go.
Great. Thanks for putting that map up. Now we know which parts of the country have been having the best time during quarantine, or where to move before the next quarantine. So a useful sort of thing that you said there is that now we need studies. And what studies have been done so far? Do we know, is it safe? And are there any side effects that we would need to worry about?
Yeah, so when you're beginning to research or investigate a new drug or therapy, I think first things first to understand is the pharmacokinetics of that drug. And this is meaning, does a drug get into the body? Once it's in there, how does it move throughout the patients? Overarching with this is that we need to determine the best delivery method to give the medication, and at the same time assess any safety factors or any adverse events that may arise. And so this all begins with a phase 1 study, which we've completed here at Colorado State University. So if I can see the next slide. This phase 1 study focused again on pharmacokinetics. We took 30 healthy beagle dogs, and they were randomly assigned to receive one of 3 formulations, either oral capsules, oral oil, or transdermal cream that we applied to the ear. And they got one of 2 doses, either 5 mg per kg or 10 mg per kg. And then after that, we measured CBD over the course of a 24-hour period. And that chart at the bottom right just shows how the groups were divided up between the 3 different formulations and the 2 different doses. So if we go to the next slide, when we measured CBD levels, we mapped it out here where you can see plasma CBD on that vertical y-axis and time mapped out on the horizontal x-axis. And this is over the first 12 hours following a 5 mg per kg dose. And the blue line shows what how the oil performed, and you can see there's sort of a nice peak and then a gradual decline, sort of what you would expect to see after giving one drug. So it seemed, at least from here, to have a predictable path. When we look at the transdermal in contrast, which is that bottom line, that's sort of an orange open face circle color, it had a little bit more unpredictable path. And then the capsules weren't too bad. They were closer to the oil, but at least it seems that the oil had a somewhat predictable route of CBD concentration. So if we go to the next slide, I don't want to get into pharmacokinetics too much because it can get a bit dry, but we looked at 3 values in particular that I think are worth mentioning. On the left side of this table, you'll see the Cmax, or the maximum concentration of CBD, the area under the curve, which is a measure of systemic exposure, and then the half-life is listed last. And we have all 3 formulations for the 5 mg per kg dosing in the middle, and then all 3 formulations for the 10 mg per kg dosing in the far right. And to direct your attention to the Cmax first, in the red boxes, we can see that the oil had the highest maximum concentration between all 3 formulations, and that it increased with the dose increase. So it seemed to be dose dependent. Similarly, in the green boxes, you'll see the systemic exposure, or the area under the curve. And again, oil wins out with having the highest value, and that seemed also to have a dose-dependent increase. And then finally, oil had the longest half-life. So looking at these so far, it seems like oil probably has the most favorable pharmacokinetic profile between all 3 formulations. So that was the first arm of this study, where we looked at how the body handles this drug. And now we need to look at what are the side effects. And so part 2 of this study, on the next slide, we continued giving them the same medication, the same formulation, and the same dose for 6 weeks total, and then kept track of the side effects that were witnessed. So the next slide depicts, again, the CBD levels, which we measured at 2, 4, and 6 weeks for all 3 formulations, which you can see on the bottom x-axis. And then again, CBD plasma concentrations are on that y-axis to the left. And this is, again, reporting for the 5 mg per kg dose. And oil here appeared to have the smallest intra-individual variability in plasma CBD concentrations. Oil are the black boxes. And it also provided equal, if not greater, plasma CBD exposures than the other 2 routes. So as we continue it long term, it did seem like oil would be the preferred formulation. On the next slide, the side effects that we observed, or that were reported, included diarrhea and elevation of liver enzymes. The diarrhea, every dog in the study at one point or another throughout the study had diarrhea. However, the onset, severity, and duration did not correlate with either the dose or the formulation they were receiving. CBD is reported to cause diarrhea as a side effect in human patients, but in this study, it's hard to really have definitive knowledge if the diarrhea was related to CBD, since we didn't have a control group. And these are research beagles, part of an enrichment program, so they get a lot of treats and variability in their diet. So our hope was that the diarrhea was secondary to lifestyle, not the drug, but we can't say for sure in this study at least. And then ALP, which is a liver enzyme, was elevated in 11 out of 30 dogs, but only those dogs in the group receiving capsule and oil. And again, this seemed to be a dose-dependent sort of elevation that would occur. We did track bile acids as a measure of liver function in these patients, and those remained normal, at least for the 6 weeks of this particular study. So while we don't know what the long-term toxicity is on the liver, at least in this 6-week study, it did not seem to have any effects. So if we go to the last slide here, so what are our conclusions from this phase 1 pharmacokinetic and safety study? What we've learned is that we can measure CBD in the blood, that the oil provides probably the most favorable pharmacokinetic profile with higher systemic exposures, and these exposures seem to be dose dependent. CBD appeared to be well tolerated in dogs, even at these higher doses that have been reported in other projects and other literature. We did encounter mild elevations in ALP. Again, that was dose dependent. Although all the dogs had diarrhea, we can't really make an association between dose, formulation, or any other parameter. So whether it's true or not, I think future studies would help enlighten on that. What we don't know from these studies is what is the correct dose, what are the adequate plasma concentrations that we should be aiming for, and is it effective? And of course, the other thought that we should have is that many of these dogs are receiving other drugs, and so are there any interactions there?
Right. And so this was your phase 1. So that leads us on to then there must be a phase 2. And you've done that. And so that leads on to then the burning question of did you find out whether it worked? What doses did you recommend now? Do you recommend? And did you find any drug interactions?
Yes. So the next slide is our randomized study that we've completed with the aim to assess the short-term effects of CBD in a patient population with the disease, because really to answer your questions, we need to give CBD to a population of dogs that have the illness. So with this, we had enrolled 16 client-owned dogs that had refractory epilepsy, meaning that they had 2 or more seizures per month. This was a prospective, double-blinded, placebo-controlled study. So meaning neither the investigator nor the client knew what medication or what compound they were giving. They were either giving placebo or CBD. And then we monitored the similar parameters we've been discussing and also their effects on their seizure frequency naturally. So within the placebo group, we had 7 dogs that completed the study. And within the CBD group, we had 9 dogs that completed the study. This dose that we selected was 2.5 mg per kg twice a day. And then the study time frame was 6 months. So a little bit longer time frame than that initial study. And so this is really trying to proof of concept when we're enrolling a small number of dogs into what we call a pilot study. So essentially a phase 2 study, as you mentioned. So if we go to the next slide, get down to the nitty gritty, our results in terms of the seizure frequency was that we did see a seizure reduction, a significant reduction in the frequency of seizures that the treatment group was having compared to the control group. And that chart at the top left kind of depicts the numbers where CBD on top, control groups on the bottom, pre versus post-study seizure frequency. And in the CBD group, 89% of dogs had a significant reduction in seizure frequency of about 33% compared to really 0 median change for the control group. However, when we took that data and looked at the number of responders, and we define responders as those patients that have a reduction in their seizure frequency of at least 50%, there was no significant difference between the treatment and the control groups. And the reason is because each group only had 2 responders. So can't be significant in that manner. So looks like it might help, but it wasn't significant, at least in this study. If we go on to the next slide, the side effects that we reported, again, the ALP elevation was repeated in this study, where there was a statistically significant elevation in ALP in the treatment group compared to the control group. 8 out of the 9 dogs had a mild to moderate elevation in ALP of an average of about 473, where our reference range is 15 to 140. In this study, we did not monitor bile acids, so could not comment, but there wasn't any diarrhea, there were no GI signs, so no other evidence that would support liver insufficiency or ailments. The other requirement in this study is that these dogs had to already be receiving at least one conventional anti-epileptic drug or anticonvulsant. And so the ones that were on phenobarbital and potassium bromide, we measured the concentrations of those drugs, and we did not see a significant difference between the treatment group or the control group in the anti-epileptic drug concentrations. And then finally, we wanted to evaluate the behavior or any changes in behavior and personality that the CBD might have. So we enlisted a validated questionnaire. I think it's about 100 questions that the clients completed before and after the study. It's called the Canine Behavioral Questionnaire, or CBARQ. And again, comparing those two scores, there was no significant difference between the groups in any of the categories that they evaluated. So the next slide shows, again, the CBD blood concentrations with relationships to the seizure frequency. And there does seem to be a correlation between the percent change in seizure frequency and the CBD level. So the graph here, the CBD is on the bottom x-axis and the percent change in seizures is on that left axis. And you can see as the CBD levels in the blood rises, the percent change in the seizures rises as well. So higher dogs with higher CBD, which are shown by those little red dots, tended to have a greater reduction in their seizure frequency. So the data here shows that looks like CBD is probably going to be helpful or could be helpful, but at least in this study, the data between the two groups wasn't significant. Now, whether that was because CBD actually isn't effective or we had too few dogs to say, or maybe the dose was too low, I think that's, again, where future studies are going to help out. So now we've completed the pilot study and we need to move on to a larger patient population. So that brings us to where we are today. And we have a larger scale study that has similar design to our pilot study, where it's still a prospective, double-blinded, placebo-controlled study. But this study is a crossover study, meaning that every dog will get both CBD and placebo at some point during the study. So we're hoping to enroll 60 client-owned dogs that are epileptic with, again, intractable seizures, meaning that they have more than 2 seizures a month, and they're not controlled with a single anticonvulsant. These dogs are randomly assigned to either receive CBD or placebo for 3 months. They had a 1-month washout, and then they received the opposite drug for another 3 months. The changes we made to this study was that we did increase the dose to 4.5 mg per kg twice a day. You'll remember that the PK study was at 2.5 mg per kg, and that decision was based on the pilot study that we did. And also at this time, Epidiolex had come onto the market, and so we extrapolated the human doses and recommendations as well into this study. We had similar monitoring, except that we did monitor bile acids here, or are monitoring bile acids here, and we are monitoring the anti-epileptic drug concentrations of all medications. So many dogs are receiving zonisamide and Keppra in addition, so we are measuring those drug levels too. And so the current status of this study is that it's ongoing. So I don't have results since it is double-blinded, but I can say that there are no adverse effects that have been reported thus far. So no diarrhea, and everyone seems to be tolerating the compounds respectively well. And then just a shameless plug, I included the email address of our clinical trials team at the bottom. So if you have patients or questions or anything, we're here to help address any of those. And if you have anyone that's interested in enrolling, we are still actively enrolling. I think we have 54 patients currently enrolled. So I think the next picture after this study is completed is where do we go from here? Obviously, we still need to have a recommended dose because not sure if the 4.5 mg per kg is going to be appropriate or if we need to elevate from there. Is there applications for CBD in other diseases? I think we need the research to prove that or answer those questions. What are the implications for other species? Right now, obviously, we can't use these in food animals, but could there be a place in feline patients? And then I think the other question that we still haven't answered is what is a safety profile for the liver? Another overarching question is, are there drug-drug interactions? Many of these dogs are on other anticonvulsants. CBD is metabolized through the liver pathway that's similar to phenobarbital and zonisamide. It's the cytochrome P450 pathway. So there's potential implications there. And at least in this human study that is up above, they did report interactions between CBD and zonisamide. Surprisingly, there was no interactions with phenobarbital, but I think we still need to figure out is CBD safe to give with other medications.
Great, that's a lot of work, as we know, and it's fantastic for you to be able to summarize it. And good luck with the ongoing trial. As we know from the current pandemic situation, people are willing to reach for drugs that may not have been thoroughly tried and tested or legal in some cases. But we have a big problem because as a profession, we're being asked by owners about the use of this, and I know we're not able to prescribe it. Are there products that vets should direct clients towards? How do we help our practitioners with the questions that they get about the CBD products that are on the market?
Yeah, so it's probably the question that I think most of myself and my colleagues are asked the most. So I think the better discussion would be directing this conversation more towards harm reduction education. This is the kind of the term that we use these days to interact with clients in CBD rather than recommending one product over another. I think in addition to not being FDA approved, there are other safety concerns that clients and owners should be aware of as they're choosing products. Obviously, the quality, the purity, and the strength of these cannabinoid products matter, and those would be very difficult to determine. Many of these products have insufficient labeling, and even worse, there's reports both by Consumer Lab and the Journal of American Medical Association that I've shown above that have indicated that many of these products are mislabeled in terms of containing either greater or lesser amounts of CBD. I think out of 84 products that Von Miller in the group had analyzed, 69% were mislabeled, 43% contained less drug than what they reported on the label, and 26% contained more drug than what was on the label. So it really is a buyer beware market. In addition to that, there's interlaboratory variability in analytical results. There could be very large differences in potency between human drugs and animal drugs because most human products are typically more concentrated. The way they're manufactured, there could be contaminants that are included, such as chemicals that they may intentionally add to increase the potency. Some of those chemicals are pesticides or metal particles. Some of the substances are unintentionally incorporated during production, like molds or bacteria. And there's a lot of solvents that can be used as part of the extraction process that could potentially have toxicity. And in addition to all of this, our human products, the edibles at least, tend to have other compounds that could be toxic to dogs as well, like chocolate, raisins, xylitol, macadamia nuts, or caffeine. And even the packaging could be dangerous to our pets. Some of the vape cartridges have lead contained in them. So how do we answer and address this question for our clients? Because we do need to offer some guidance. We can't just say, nope, don't use it, because they'll probably make their own decisions. So we want to make sure that, again, we're doing this harm reduction education. So if we go to the next slide, This is kind of what I guide owners to when they say, what products do you recommend? I say there isn't really one product out there, but what I would encourage and almost insist that they do would be to ask for a certificate of analysis from the company for each batch. They shouldn't accept just a general one for all the batches. That each batch of CBD should have its own certificate of analysis. This should be performed by a third-party laboratory. In-house analyzers are brimming with concerns, so that would be the other thing that they should ensure. And then on the certificate of analysis, it should say that this CBD was made from a plant with less than 0.3% THC. This product has high CBD and low THC because, as we know, THC is very toxic to dogs. So we need to ensure that the product has this less than 0.3% quantity. And at least in Colorado, the supplier of the CBD product should also be able to produce the Colorado Department of Agriculture certificate. And this just shows that the hemp grower was certified and that they are certified to grow products that contain less than that 0.3% THC. So next slide, in terms of how to guide veterinarians, again, it's not legal for us to administer, dispense, prescribe, or even recommend hemp or other cannabis-derived products outside of that Epidiolex that's FDA approved. There is other, like I said, other info on the legal site for the AVMA, which has a lot of helpful guidance, but really it becomes, again, this harm reduction education. The Colorado Veterinary Medical Association has a position statement they put out that states that as veterinarians, we have an obligation to provide companion animal owners with complete education regarding the potential risks and benefits of marijuana products in animals. So it is truly a buyer beware market. It's hard to guide clients, but I think through educating them on the risk and benefits, we can still offer a lot of insight on how to go forward at this point.
Great, thank you. That is a good place to end the buyer beware. So knowledge about what you're actually using is going to be important. I'm going to hand you back now. Thank you very much for that. I'm going to hand you back to Laurent, who has some questions from the audience.
Thank you very much. Thanks a lot, Lisa, for this very enlightening presentation. The first question, I think is quite important. You know, how much does it cost, actually, this medical CBD? I presume in your study that was not a consideration, but if a drug was proven to be useful in the future, you know, what kind of costs we're looking for a pet owner?
Yeah, I don't have the exact numbers. I can certainly get those for you, but I do know that when we've looked into it in the past, it's been cost prohibitive for most clients. A colleague of mine had looked it up for clients. So I think speculatively, if I'm speculating, probably several hundred a month. It could be more though, but usually with human products, being that it's not generic yet, I suspect that it would be fairly cost prohibitive.
Yeah, I think it's a very good, question, especially for all our pet owners, the increasing cost of all the anti-epileptic, and very often they will go onto that option when they exhausted all the other option and have a big bill every month for treating their dog. Another question as well from Fred. I'll let you read as well. Is it known what the longer-term receptor profile in cannabinoids as a primary receptor-based treatment when compared to other AED? Do you have thought on the long-term tolerance of that medication, of that drug?
Yeah, it's a challenging question to answer because we don't have long-term studies yet, to my knowledge. And we don't actually understand how these cannabinoids work. We have knowledge of endocannabinoid system that humans and animals contain just in our bodies. But actually it seems that both THC and CBD do not act through these cannabinoid receptors themselves. There's a lot of other pathways that have been implemented, like G protein coupling, other pathways. So I think even just understanding the mechanism is still a bit of a cloud on how CBD has its effects, since it's not through the cannabinoid receptors. So I think understanding a long-term profile is a great question. I think that's a site for a focus for other studies to certainly look into. But I think first we have to have a better understanding of how CBD actually has its effects.
And do you think they develop functional tolerance to the drug?
Yeah, again, I don't think we have a good enough understanding into the pharmacodynamics of this. Is the receptor, how long is it bound for? Does it change? Does it, can they build tolerance? I think looking at other anticonvulsants, we do see this so-called honeymoon effect. So whether CBD is going to have a similar profile, I think is still, I don't think we have that knowledge yet.
About a Fred question, I mean, in human, do they have this issue of honeymoon effect or functional tolerance with long-term use?
With CBD, I don't. Again, I think the studies in humans are pretty sparse in terms of controlled, placebo-controlled long-term prospective studies. So I think the knowledge, there's certainly a lot of gaps out in the human literature as well.
I'm going to take another couple of questions. There's another one about, I mean, potentially, if there's a place to use it as a monotherapy at some point and assess that. Do you think there is any rationale in doing that?
So using CBD as a monotherapy has not been evaluated. I don't think it's, at this stage, I don't think there's a place for it to replace conventional therapies that are tried and true. And we have a lot of evidence-based medicine to evaluate the risks. So I think moving forward, once we, if we hopefully can have a better idea and understanding of its efficacy, if it truly does help with seizure reduction, then we can start to investigate it as a monotherapy. At this stage, I think I would be very hesitant and reluctant to use it as a monotherapy. And in my mind, it would be an adjunct if we were ever going to use it. So it should not replace conventional therapies that are proven effective.
One more question for you, Lisa. It seems that in human, the combination of CBD with phenobarbital increase the level of phenobarbital. Is it the same in animal? I think you kind of answer it, but maybe you want to go back to it.
So far, it doesn't appear to be, at least in limited cases that we've reported on, and at least in that human paper that was published in Epilepsy, they did not find interactions or changes with the phenobarbital concentration, which is actually what I would have anticipated, since CBD does block cytochrome P450. I would have expected phenobarbital concentrations to rise, and they didn't, at least in the human literature. But zonisamide actually did. Zonisamide concentrations actually elevated. So I think we still don't know entirely, and obviously animal metabolism is very different than human metabolism, and we can only extrapolate so far. But I think once we've completed our larger scale studies, we'll have a better idea if there's any interactions with phenobarbital.
I think I wanted to ask you one more question from the other. Someone asked, if there's an antidote for that medication. I presume if a dog overdose or the owner overdose, what can we do about it?
Mainly it's supportive care, IV therapy, supportive measures, and time. I would presume that the CBD binds from its receptors, and the dogs generally have a very good outcome depending on dose and tolerance and other factors that would go into it. But generally, there's no antidote that I'm aware of other than supportive measures and supportive therapies.
Okay. And last question I wanted to ask you, knowing what we know now in human medicine, and maybe some of them are proven, some of them are anecdotal, could you look at other application of CBD in neurological disease in dog and cat? If there's any, aside from epilepsy, if there's anything else you think would be worth looking at?
Sure. I think pain therapy is underway. We've another group here has completed an arthritic study for pain control. So the results are still not published yet, but the study's finished. So I think there could potentially be we'll see what the results show in terms of using it for pain control. Cancer therapy, obviously, a lot of people use CBD for that as well. Whether that would help our patients, I think it's hard to know. Do brain tumors cause headaches, or spinal cord tumors painful? Potentially CBD would have other anti-inflammatory effects as well. I don't think we have those answers just yet. Could there be a place with canine cognitive dysfunction, which is sort of the similar model to human dementia? I think that would be very fascinating and potentially an area to look into in the future. So I think first, trying to isolate its effectiveness in one disease population, here the epileptics or our pain treatment patients, is the first step. And I think the world is our oyster after that. We could try it in other stories. Yeah.
And it's also much easier to actually assess with epilepsy. You look at the frequency with pain.
Right.
It's obviously a little bit more difficult to measure outcome, in this population. The reason I was asking, in the UK, we have a lot of dogs with Chiari syringomalia. And, some of the people listening were asking questions in that case, can he be used in this dog with syringomalia or Chiari malformation, but I presume that, the future will tell us. But we don't have
Yes, I wish I had answers. I think there's potentially a lot of options and opportunity for CBD if it works. But I think the first step is to see if it works, at least in a population that's easily evaluatable, like you mentioned.
But thank you so much, Lisa, for sharing your time. I know you're very busy.
Thank you so much.
Thank you, Lisa.
In Colorado. And I will ask everyone to join me to give a virtual round of applause for Lisa and for this fantastic presentation. Simon, I don't know if you want to add, something as well.
No, really, really great presentation, Lisa. Thank you very much. You hit all of the high points there, so we appreciate that, and look forward to finding out what you and your team come up with in the next short while, no doubt.
Well, thank you so much. I appreciate the invitation and your time and your audience's time.
You had people from all over the world. I think we had people from Peru, Brazil, Thailand, obviously Europe, US, Canada. So thank you so much for your time. Have a good night, everyone. And we'll see you next week. Before we go, I will just tell you very briefly what we got in plan for next week. If I manage to find my screen. Here we go. I'm going to make it a bit bigger for you. So next week, we've got a neurology specialist. Colin Driver will be talking to us about how do I manage thoracolumbar myelopathies in pug dogs. Specifically, we'll be discussing about this stenosis, meningeal stenosis of meningeal fibrosis in pug dog. Colin has a lot of experience in that, both on the imaging aspect and the surgical treatment. And then the following week, in 2 weeks' time, we'll do a double act. Professor Johnny Ness and I will go back to the clinic and we'll discuss our approach to forelimb lameness/paresis. When do we know it's ortho or neuro? What kind of condition to look for? And also what kind of investigation to carry out in this cat and dog. But leave me to thank you, everyone. Thanks a lot, Lisa, for spending time with us and sharing your expertise tonight. And have a good evening, everyone. Goodbye. Thank you.
Yep. Thank you very much.
Thank you.
Bye.
Bye.